Hello, I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner. I am also a chiropractor since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
Today, we are going to discuss chronic pain. There is no silver bullet. And this is going to be a challenge. We're going to try to keep this to 40 minutes or less. The reality is we'd probably talk about this subject for the next 10 weeks. And as Mr. Producer here just reminded me, you could probably look at all 140 to 200 hours. I don't know how much we have online,
Right.
of our presentations to understand why there is no silver bullet to chronic pain. This is apparently one of the most asked questions of my staff. I just found out. And I just, again, in our little conversation before we started this, I just let Mr. Producer know that there isn't a day that goes by that I don't have to address this question in the consults. I think the most prominent one that I get, frankly, is the patient who comes in here with thyroid. And the thyroid patient is pretty kind of like focused on thyroid, kind of like the Mayo Clinic.
Right.
You want to know about that? Look at our thyroid presentations. We talk about the Mayo Clinic. And they're focused on thyroid, and there's so much to the thyroid. But frequently that patient is looking for another herb or another botanical, or as I put it to them, another magic pill that is going to take care of it. And if there's any condition on the planet that there's no one magic pill for, it's the thyroid, because there's so many systems involved. The gut's involved, the stress hormones are involved, the liver's involved, the receptor sites are involved, the pituitaries, all these different things are involved. And that patient's coming in looking for a new thyroid herb,
Right.
or a new thyroid botanical, better known as the silver bullet or the magic one. We've done it. There is no silver bullet before, but we're going to do this one.
We've done it for other
things.
Yeah.
So we're going to do it
yeah.
in general right now. And we're going to try to miraculously keep this thing to 40 minutes or under. Okay. Because truly we could talk about this. Well, we do. We essentially talk about this every week, but we don't say there's no silver bullet.
Right.
So there's no silver bullet for chronic pain, because chronic pain, we're going to go into it, is multiple systems. It's multiple vicious cycles. It's multiple interrupted biochemical pathways. And one of those pathways is stress hormones that I think is one of the most underappreciated aspects of it. There's so much to it, but we're going to get into it a little bit more scientifically here, at least the way I see this, and maybe help you understand why that pill you took didn't work, or why it worked and then didn't work, and so on and so forth. Okay. Chronic pain is a challenge. It's paradigm. There's a science to it. There's an art to it. There's a lot of moving pieces, and we're about to talk about it. So Dr. Gates says that the definition of insanity is to do the same thing over and over again and expect results. I've never heard that before.
You never heard that before?
Like about 1 million
Being
times.
facetious.
What did you say?
I said, what?
Oh, right. Okay. So why don't you explain why you chose that pretty time-worn expression for this topic?
Because since I've been in practice, since I've known you, the estimates on chronic pain have varied between 45 million, and then went to 70 million in 2011, and now it's 130 million in 2016. And last week, now it's 59% of the adult population.
No,
of the entire population.
Of the entire population. They specifically stated, and that includes children.
So now we must be over 130 million in that estimate, because we have at least
160. It's 320 million people in the country.
Yeah.
So more than 160 million people, according to that.
So it just keeps growing and growing and growing. And we see the tragic cases associated with this chronic pain system that we have. We're not trying to knock anybody we're not knocking chiropractors or physical therapists or medical doctors. It's just the system is broke. We have a major problem and it needs to be overhauled. And now that discussion is coming up, but frankly, some of the solutions are pathetic in our experience. I mean, they're talking about building bike paths and green belts. And, that's all well and good, but that's not getting to the cause of the problem.
Changing the diet, which is a part of the a part of the solution.
It's a part of the solution.
Part of the solution.
We've seen what's happened with the cafeteria initiatives,
which has been rejected.
Yeah. So
and they've put good foods into high schools, and I don't know if you're aware of this, but now there are high schools that are going back because the kids won't eat the good foods. Right. They're wasting the money and so on and so forth.
We're not knocking that, but there are bigger overarching problems at hand. We appreciate Mrs. Obama's initiative on that 110%. But again, it's not enough. So we have this pain management system basically that people fall into, and they seem to kind of stay in, frankly. So what does that look like? So it can be a variety of different things. So chronic pain is just this huge umbrella of conditions. It could range from the person with low back pain, to the person with chronic knee pain, to a person with fibromyalgia who has pain all over their body, to the peripheral neuropathy patient who has burning pain in their feet and their legs, or a spinal cord injury patient who has horrible pain all over their body, to the MS patient. There are so many different conditions that we're going to try and bring under the umbrella, but let's just use a few examples. So if you have low back pain, for example, what do? The low back pain patient, they go to their GP. The GP says, okay, you have low back pain, maybe let's run some x-rays, let's do an MRI, you have a bulged disc. Maybe you go to physical therapy because that's what your insurance mandates. Maybe you even see a chiropractor. Maybe the physical therapy and the chiropractic don't work. So then you have to go to
acupuncture.
Acupuncture. That doesn't work. So then you go to...
all of which work for a lot of things, okay? But not as well for chronic as for acute.
And so then you go to the surgeon's office, or you go to the pain management doctor's office. And so they maybe try different drugs, they're trying injections, they may be doing epidurals for your lower back pain. And ultimately the back pain is still bothering you and it's not working. So then you get the surgery. And for example, with the low back surgery, you have about a third chance of getting better, a third chance of getting worse, and a third chance of having no change.
Can get worse.
And so either you get better, or you're the same, or you're worse, and now you're back to pain management, or you're looking at another surgery. And then you're seeing your pain management doctor because they're out of options. Now they have to start using opiate medications frequently. Now you're taking a lot of opiates. People, when you walk into the doctor's office, they look at you like you're a drug addict because they're worried that you're going to be selling the stuff on the street for a big profit. And that's chronic pain for a low back pain patient.
Yeah.
As an example.
Yeah. For a general patient, the way I explain it, that's perfect. For those of you who are going, well, I don't have low back pain, this is the model. This is generally the model. If you want to expand it, what happens in chronic pain is something goes wrong with your system. It goes wrong with one of your multiple systems. Maybe it goes wrong with your nervous system. Maybe it goes wrong with your endocrine system, your immune system, or something like that. And you don't really know it. You're walking along, life is good. You don't have any symptoms. And then all of a sudden you start to get symptoms. Now you're in here. Now you have symptoms, but you go to the doctor and all your tests are normal. You have headaches, you have dizziness, you have vertigo, you have balance problems, you get CAT scans, you get MRIs, you get EEGs, you get all that. It's normal. You're putting on weight, your hair's falling out, you can't lose weight, you got constipation, you got dry skin. Next thing you know, you got heart palpitations, you got anxiety, you got this. You go to the doctors, they do all these blood tests, they're normal. Now, maybe after 10 or 15 or 20, but you're still, after 10 or 15 or 20 years, of course, these symptoms are getting worse. They're getting worse. You're now panicking. You're stressed out of your mind, which is now contributing stress hormones to your problem. You're getting worse. And now over here, things start to show up on your tests. Now you start getting little white things on your MRI and they say you got Alzheimer's or you got some sort of problem with your brain. Or now maybe your blood tests start to show that you got diabetes type 2 or whatever. In the meantime, you had the blood sugar problem the whole time or the thyroid problem the whole time. And now it's over here. This is pathology now. This is where you can see it, touch it, feel it on a test. You can see it, touch it, feeling on an image, on a blood test. Now, much of the time, it's almost too late to do anything. But if you're in that pain management model, now you're going to get the drug. Now you're going to get the pain management. It's probably not going to get better, and they're going to manage your pain for the rest of your life. This is where the vast majority of the 160 million people are, where they have the symptoms, nobody knows what's going on, and so on and so forth. It's because the testing has not been evolved for this yet. It's because the model that is being used for pathology and also for chronic pain or acute pain Also for, I broke my leg, I got a cold, I got a flu, I have an antibiotic for my bacteria, I take something for a virus, I go and get a surgery for my appendix or something like that. That model is being used here for the acute person. That model is being used here, over here. Let's use cancer therapy, let's use radiation therapy, let's do a surgery, let's do drugs. But here's where the chronic pain people are at the point in time where they can be helped. Okay, so you have these two things going together. And this model is not going to change anytime soon because it's difficult, just simply because it's difficult to change. Most of the stuff we're talking to you about is going to be in the literature. We've got hundreds and hundreds and hundreds and hundreds of peer-reviewed journal references attached to all of the hours that are online. We didn't do that. We're probably talking hundreds of millions of dollars worth of research that's out there, but it's not being used totally or at all because what of it is being used is to produce more of this model, the acute pathology model, more drugs, more surgeries, more of that type of stuff. And it takes a long time to do that from the time they decide even to, and I'll let you talk, from the time they decide to produce the drug to the time it comes out, I think historically people now know is a long time. 10 years, 15 years or something like that. So that's part of the problem that we're facing with chronic pain.
Our healthcare system is built on the scientific method. The scientific method is such that we give one product, it's more effective than a placebo for this condition, and then it eradicates the problem. So like antibiotics is the perfect example.
So this is silver bullet medicine now. Antibiotics,
this is a silver
surgeries.
Bullet. So we're all looking for a silver bullet with chronic pain. We're looking for a new pain medication, a new anti-inflammatory. Because so many of you with chronic pain, because you're in pain, you think something has to be wrong. Something has to be wrong with my whole body because my whole body burns and I ache. Something has to be wrong with my low back. And everybody becomes fixated on, oh, I have arthritis in my low back. Oh, I have bulge discs in my lower back. Well, the news is, about half the people walking on the street have the same problems in their low back and they don't have pain.
Right.
So why do you have pain?
Right.
And that's what people don't get, because it's not necessarily your fault. It's just the way we're conditioned with the medical system. Oh, Jerry, you got a bulge disc. Okay, we got a problem here. We either have to cut it out. We got to give you a shot to take care of it. And then hopefully that gets you better. Well, the issue is within this research war machine, almost, this research machine that we have in our society. I mean, billions upon billions of dollars going into it. Everybody is looking for that one thing in their research domain. So frankly, they may make some big money doing it. And
the solution or not.
Right. And unfortunately, patients get trapped into that. We also have patients now at the exposure of massive marketing methods, not only by the pharmaceutical industry, but by the supplement industry. It's as equally nauseating to see the supplement industry advertise like the pharmaceutical industry. And so you're out there, you're saying, I'm in chronic pain. Well, maybe Lyrica will help. I have chronic pain. Well, maybe diclofenac will help. Well, maybe this lumbrokinase supplement is going to help. Right.
Short-term memory loss supplements.
Yeah, exactly. All those supplements, ginkgo biloba and different things of that nature. So you're thinking that one thing may help you. And we get patients who ask us these questions all the time. Well, hey, doc, what can I take for my diabetes? Hey, doc, what can I take for my thyroid? Hey, doc, what can I take for my fibromyalgia? In our experience, there's not one thing you can take. Every patient walking in here is completely different. We just had some cases who they'd gone through our program. They were doing fantastic. They're incredibly happy with their results yesterday. And I was talking to them. And it was so interesting because even though at the onset of their program, 6 months before, 4.5 months before, and I thought I had the solution in my head doing their exam, it turned out that they were far more complicated than I even thought. And so it's an example where if somebody comes in with chronic fatigue, I'm thinking maybe they just have a stress and adrenal problem. Simplistically, I thought that's what this case was. Whereas in actuality, they had confirmed Hashimoto's, they had an iron deficiency. Yes, they did have the adrenal problem, and they had some viral infections, and they had gut dysfunction. So we had to patch up all those different things to get them better so that their fatigue will be improved and will stay improved.
That's such a perfect example. So those of you who may be conversant with the alternative fields and even the medical fields may know that for years you had chronic fatigue or CFIDs or chronic fatigue syndrome. It was thought to be Epstein-Barr virus, which also can contribute to it, but it is not. But chronic fatigue can be just what Dr. Gates said, thyroid, blood sugar, stress hormones, gut problems, Epstein-Barr virus. It can be anemias, different kinds of anemias. Okay, so you need to understand that. So you go to your local alternative vitamin guru, and they give you an adrenal supplement. Continuous.
Exactly, which may help a little bit,
a lot,
but it's not going to fix your problem when you have all those things going on.
Yeah.
And so that's one example of the chronic pain conundrum and chronic disease conundrum.
Yeah, and the silver bullet thing, I think it has a lot of legs for a lot of reasons. It's easier. As a clinician, you're in practice, you've got an entire paradigm that you're talking about. Maybe you're an acupuncturist, maybe you're a chiropractor who's done nutrition forever, dietitian, whatever. And you have a naturopath, and all of which are valuable professions. But when it comes to chronic pain, that person comes to a class, you talk to that person about that class. And I've been in these classes, and I actually was lobbied to teach some of these classes. And one of the things that turned me off from doing it was that the professor that was teaching these classes, or the doctor who was teaching these classes, was so well informed on these matters, and he would continually be interrupted because people wanted to bring their paradigm. Well, I do this, I give this, and I get good results. And the doctor would say, yeah, but are they long-term results? Are they things that you would fix forever? Well, when I use these B vitamins, the person feels better. And the doctor would say, well, why does the person have a B vitamin deficiency? And do they have H. pylori? Do they have intrinsic factor problems where they have an immune problem? Do they have an absorption problem? Do they have these types of things? And the people would get insulted. Because when you're in practice for a long time, I can tell you from personal experience, it's not easy to embrace an entire new paradigm, put everything on the side that you've learned that you think you know, and then morph into this. I mean, you were here when I was in the processes of doing that. That's when Dr. Gates showed up. So you have that issue going on. The silver bullet is a much easier thing to assimilate into somebody's arsenal. Take berberine for your blood sugar problem. Take berberine for your gut problem. Take, like the ultimate, probiotics. I mean, and there are times for probiotics, we don't use them that much. We don't use them that much. We keep this to 40 minutes, so you probably have but I wanted to bring some of the, some of the practicalities that I hear every day
for sure
in there to it, because those are the things that, these are the explanations that people are asking for when they're sitting in my office going, well, how come I tried this diet and it felt good for a while and it didn't feel good? I mean, I go into leaky gut, and why people can't get their leaky guts fixed, doing everything right that you find on the internet. I go on for that for ages, because most of them have stress mechanisms that are overwhelming, and those stress hormones are sabotaging their intestines with cortisol while they're trying to fix their leaky gut with herbs. So they're doing the herbs, the stress hormones are sabotaging it. They feel better for a while because the herbs work. They stop taking the herbs. The stress hormones are still sabotaging them. 6 weeks later, they feel like crap. They develop new food sensitivities because the stress hormones have damaged their gut. And now they've got leaky gut again. And now they've got new, and they're like, now what?
Yeah, I think that's a perfect example.
That's just a small part of what sabotages people of being unable to get their guts better.
And I think we should look at Americans as a generality. So let's look at the average American out there. So we've talked about this in so many broadcasts, and for our faithful listeners, I'm sorry.
You know what?
I'm just going to go through the average person. So just from a percentage basis, 2/3 of us have a weight problem. We can just start there. 1 out of 3 females have Hashimoto's. 1 out of 5 females have hormonal dysfunction enough to cause their menses to be abnormal and to maybe have trouble getting pregnant and have unwanted hair growth. The statistics just go on and on. 30% have anxiety, 50% have insomnia, 16% have major depression, not counting other forms of depression. So let's take the average American. Let's say we have one of the 2/3 of the population. Let's take an individual who has a weight problem. And let's look at what that person is going through on a daily basis, just from a generality that we see. So that person maybe is working a lot. They probably don't sleep enough. They're probably under stress. They probably drink coffee to get going in the morning. They probably drink coffee in the afternoon. They probably eat a largely processed food diet consisting of highly refined carbohydrates and grains. And they eat a lot of different foods that seem to grow these populations of bad bacteria in their gut. Also, the meats that they eat are highly inflammatory because the meats that they eat come from animals that consume certain foods right before they die at the places where they are slaughtered, that basically change their inflammatory fat ratio to 25-1 or 30-1. Whereas when that animal is out in the beautiful field, its inflammatory fat ratio is 4-1. So now you're eating this inflammatory meat, you're eating these processed carbs, you're growing these bad bacteria in your gut. We are what we eat. So when you eat that hamburger, guess what? The fat from that hamburger makes up the cells of your body. And so now this individual is out in their yard mowing their lawn on the weekend, they bend over wrong, they throw out their back. When they throw out their back, basically a joint in their back moves a little too far really quickly. And that creates a lot of inflammation. Basically, you may tear some ligaments at a very, very minute level. We're not talking about drastic tearing. And those ligaments and those membranes are made of these inflammatory fats, and then that releases way more inflammation and way more inflammatory, significantly larger inflammatory cascades than you should have. So now you have a bunch of inflammation in your lower back, and now you start down that process that we talked about. Where all these things, going to the chiropractor, going to the physical therapist.
We're talking about those of you for whom that doesn't work.
Right. And then you have all these interventions, and this person is never fully stabilized because all those things that I just laid out between their diet and their lifestyle habits are really what set them up to have these chronic pain conditions. And that's what's being neglected. And I don't think that building a green belt is going to be enough to overcome this. We're going to have a major epiphany as a society and really look at the problems going on with our health, and especially, sorry, we talk about it every week, but our gut health as it relates to our entire physiology.
And the green belt thing is the government saying we're going to build green belts and bike paths so that we can exercise more, and then we're going to alter our diet according to Mrs. Obama's thing, which we agree with, her thing, okay? But the reality is
I don't think it's going to be enough.
It's not. That's like peeing on a forest fire when you're talking about chronic pain.
And we're throwing money at the problem when really we're not confronting the problem, saying, okay, this is what the problem is. So with that being said, then we look at the gut. As Dr. Rutherford was saying, the gut is such a pivotal aspect of what we do. The gut is the center of our body. Everything we take in terms of our food and our drink goes into our gut. And so that's a good place to look. They're basically associating the gut with so many different chronic pain, chronic immunological conditions. As we've talked about, bacteria get dysregulated, pieces of bacteria break off. That causes insulin resistance, which not only causes weight gain, but creates obesity. Obesity, once you get that fat, that creates inflammation unto itself. So it's an organ that's
unto itself,
promoting inflammation. It's like an evil dictator. And then your immune system.
Multiple vicious cycles. That's what he's talking about. Multiple cycles that you can't shoot with one bullet.
Exactly. And then your immune system may start to get inflamed against the foods that you're eating. Pieces of food are getting through, pieces of bacteria are getting through. That creates these inflammatory responses. I could give you the technical name, but it's inflammatory responses going throughout your body that then negatively affect the way pain is sent to your brain, as well as how your brain perceives pain and how your brain functions. And so we've talked about this on fibromyalgia broadcast before, because again, everybody thinks that something is wrong with my joints, something's wrong with my arm. And
I had this conversation last night while I was walking my dog.
Oh gosh, okay. So something so typically is not wrong with the affected body part after you've had all these MRIs and CT scans and everything is normal and you haven't responded to traditional therapies. And so if you stab your hand, for example, yes, you're going to have pain because we have pain nerves there that send pain signals up to your brain. But the problem becomes with the inflammatory soup that I just talked about between the lifestyle and the diet. You may have trivial trauma, and trivial trauma starts producing the same pain as though you were stabbed, because we have people who come in here who really have nothing wrong with them inflammation-wise or in their joints, but they feel like they're being ripped open. They feel like their skin is being torn. They feel like they're pulling muscles all the time, and that's not happening. They feel that way because their pain nerves are sending too many signals to their brain. And then we have natural mechanisms in our brain designed to shut off pain. What a concept. That's how we discovered morphine that now everybody's addicted to, and we have a major drug bust here in our local town regarding this one important chemical. And because of morphine drowns out the pain. But with all the factors that I relate between the stressful lifestyle and then the inflammation of the body and that negatively affecting the brain, those natural pain mechanisms that drown out the pain they don't work anymore, or they work much less effectively. So now you have nerves sending more pain signals, you have your brain not working as well to shut off the pain. Now you're not sleeping well, and that doesn't help you to shut off the pain. So now you get into this chronic pain cycle. And now the studies are overflowing, basically, that patients who have chronic pain, it is a brain disorder largely, to where their brain is processing signals abnormally. They're paying too much attention to the pain. And we're not saying that you're bad or that you're doing something wrong. It's just, it's a natural mechanism that you can't control given the circumstances. And that's why the pain becomes so overwhelming.
Yeah. So pain is neurologically based. What we see mostly is pain is neurologically based. The X factor to us seems to be the neurological aspect of perpetuating it. Certainly, I had a lady in here yesterday. She had such a tough life. I mean, clearly it was the cause of her issue. You have an autoimmune problem. That's it. You mentioned briefly, I think you mentioned in that whole list that you did, that 70% of the immune system was in the gut.
I didn't say that, no.
I didn't think you did, but I was giving you credit for saying it, because you usually do.
Right.
And that's huge, because what do we do? What do we have now? We have, even the doctors now are starting to get, we have this massive underlying autoimmune problem. I'm hearing it more and more. We talked yesterday, the one lady checked us out with her Lyme doctor group that she's going to go to in Colombia. And they said, well, these guys said that I probably have an autoimmune problem. And they said, you know, they might be right. You might actually have an autoimmune problem. So that was shocking.
She does have an autoimmune.
And she does have an autoimmune problem, which what we talk. But the point being, autoimmunities, immune system's a system. Overfiring sympathetic nervous system, that's flooding your system. You're stressed out of your mind. You're in post-traumatic stress syndrome. Your brain never shuts off. You can't sleep. You wake up in the middle of the night. You can't go to sleep. You can't stay asleep. These types of things. You had a bad gut. Oh yeah, my gut's okay. I said to the patient, well, okay, you're probably the only person in the United States that has a good gut then. So let me ask you a couple of questions. Do you bloat? Do you have acid indigestion? Do you have, oh yeah, I got all that. Well, guess what? That's a problem. Okay. You just haven't gotten to the bad stuff yet of diverticulitis or colitis, or maybe haven't looked at. There's another system. So there's 9 major systems in the body, and it can all interface. I was talking to somebody the other day, and I said, well, just think about it. I said, you have a bad gut, 75% of your immune system's in your gut. So if things start getting out there, and that 75% immune system, by the way, is contained in one cell layer thick inside of your gut. So my guess is it's not that hard to disrupt or irritate, okay, with all the different things that we're doing to our gut, stress hormones, bad foods, the cow that's not eating right, just the food itself, just all kinds of crazy stuff that's going in there with manufactured foods and all that type of stuff. Leaky guts that are causing inflammation. You got all that stuff. So you got 75% of your immune system that's in your gut. So if that starts getting messed up, it can attack what? Anything. Anything. Virtually any tissue in your body. You have a bad thyroid, which a lot of our people have. Most of our people have something called Hashimoto's thyroiditis, as a receptor site in every single cell in your body. Okay. What could that affect when it goes wrong? Anything. And to make that one even better, it gives you hypothyroid symptoms, and then it gives you hyperthyroid symptoms, and your heart starts pounding, and you start getting irritated, you start getting jittery, and you start going, and you end up, and if you're stressed at the same time, and you have stress hormones going out, what can those affect? Just about anything. So now you got the stress hormones flying, you got the Hashimoto's flying, and that's getting attacked, and you're up like this, and you got a bad gut, and you got 8 million symptoms going on. You end up in the hospital because your heart's about to rip out of your chest, and they do all these tests on you. Go, everything's normal. Here, take some electrolytes. See you later. This is chronic pain. This is why there's no silver bullet. In that scenario, there is virtually nothing in your body that is exempt from being attacked or affected symptomatically. Would you?
I agree.
Would you say?
I agree. And I think your point on the stress hormones is perfect, because the stress hormones, we attached articles. Now the new therapy, anesthesiology journals are looking at giving people stress hormone blockers, which are typically used for like high blood pressure or people who have their heart palpating. They're looking at giving those to chronic pain patients. By the way, they have the unwanted side effects of causing extreme fatigue for all of you chronic fatigue patients, because this is their model. Okay, this is our silver bullet for now helping chronic pain patients, because we acknowledge that these stress hormones bind to pain nerves, and they're like gasoline on the fire for pain signals. Stress hormones are like gasoline on the fire for pain signals. Also, those stress hormones, as you mentioned, they break down the leaky gut. Also, those stress hormones, they build up the fear center in the brain. So you get more stress hormones, you get more fear signals. And the whole process, the vicious cycle, so to speak, keeps going. And that's why there's no silver bullet. And that's why, and simplistically, the way we approach chronic pain is from the perspective of, you got to get the fear center turned off. That's number one, because then the gut has a chance to heal.
Preferably without drugs. Now, again, we're not anti-drugs. We work with medical doctors literally on a daily basis, okay? But in this particular case, drugs are not the answer, except in extreme cases, except in extreme cases that just can't respond to a non-drug therapy. The guy who comes back from the Gulf War and is maybe on the edge of suicide or something like that.
Absolutely.
You know? That, for them, we're talking medication, we're talking psychotherapy, we're talking all that type of stuff. But that's not 98% of our patients.
We're also talking about getting parts of your brain strong that shut off the stress responses. That's really what we're talking about, because these parts of our brain, we're not using them anymore. Because if you look at our lifestyle, and we're probably going to talk about this today we do another broadcast to all of our patients who are actively or who are in their maintenance program. We're going to talk about technology, because you look at what the average American is enduring on a daily basis today versus 20 years ago. I was talking to a colleague over the weekend. She said, "Why are my patients so stressed out? I can't get them to calm down." I said, "I know. Welcome to my world." Well, yeah, exactly.
What are the Yankees doing?
There you go. And so we're constantly distracted. Just take yourself back. Close your eyes. Go back to 20 years ago. What would that be, 96? Go back to 1996. I go back to 1996. Maybe the phone rang, you had an answering machine. Wow, that was pretty cool. And then you had a few TV programs on at night.
You said that's a few. When I was a kid, we had like 3 stations that were off at 1 o'clock in the morning.
Well, I grew up in the area. I grew up in the
CBS.
Country, so there's no cable TV.
Oh,
So we just had a few TV shows. You know, you did your homework. You just kind of relaxed. You talked to your family. You talked about your day. You went to bed at a reasonable hour. You got up. I mean, I didn't know what caffeine was until I went to college. I mean, I didn't drink caffeine. Versus today, everybody is stressed out. They're working late because they're trying to get ahead. They're not sleeping enough. They're drinking their caffeine. They're rushing on their way to work, barely eating breakfast, going all day long, eat a huge lunch. They're sleeping in the afternoon. They drink more caffeine. They come home late. They're exhausted, trying to take care of the kids. They're getting a bazillion messages on their cell phone. They're looking on Facebook. They're checked out because we're so overwhelmed, because we're driving this fear mechanism in the brain. We're not utilizing these other parts of our brain that are so vital to focus and attention and shutting off the fear center.
Yeah, and our brain's ability to manage stimulation is not, if it ever synchronizes and it ever evolves to being able to handle that, it's going to be a while. Right. And our immune systems haven't really. I use the term evolve because it's the only one that's coming to me right now. Okay, but they haven't really synced out to be able to handle the number of attacks that are being presented to our immune systems today through all of these things. And thus we have a problem.
That's why we have a problem. So really, in our model, you have to fix the brain first. You have to fix the stress mechanism. You got to talk to patients about lifestyle. These conversations need to occur. We have a lot of patients that come in here, they're in a stressful marriage. We'll tell them, hey, you need to go to marriage counseling before we do this, or you need to go see a psychiatrist, not from a negative, denigrative standpoint. No, you need to go see our colleague and have this issue dealt with before we work on this, or maybe not. Maybe we can handle it and you can go see your psychologist or your psychiatrist, your hypnotherapist, while we handle this all in conjunction. But you as a whole and your lifestyle has to be addressed if you have chronic pain. It has to be addressed. Your brain has to be addressed, because if that's addressed, then you can look at the gut. And when we look at the gut, it is more complicated than just probiotics and a paleo diet.
So if you have a bad gut, you have probiotics, you go to somebody, you go to your dietitian, or you go to your nutritionist, or you go to whoever, and they give you probiotics, but you're going through some serious marital issues or something like that. It has no chance of working anyway in most people who come into this office. But there's so many multiple systems that are involved in damaging that gut. And we're not picking on probiotics. It's just the one that's advertised the most out there. We get the advertisements all the time for, this is going to fix the arthritis, and this is going to make you sleep, and this is going to get your brain working better, and this is going to be the new miracle thing. And people spend millions and millions of dollars taking that stuff. It's usually some flyer that you get in the mail, or it's something on the TV that says, get it now. We're only going to give you like 1,000 and we're only going to give out 1 million to, or whatever it is. And
it's, yeah, exactly. It's one thing for one condition. And now there are doctors who are hosting teaching seminars for patients and showing them, okay, well, this is a supplement you take for your leaky gut. So they're giving them protocols, but all the while, why are they doing that? Because they know that they're going to hook them on supplements, and these people are going to be ordering supplements because I've looked at the programs. And so
I think he's been to the seminar.
No, I'm talking
to
about
check it out.
Right.
Oh,
I've been, yeah.
We've gone to this stuff. We've gone to this stuff, okay, to check these things out.
But then these doctors get these patients hooked on supplements, just like you'd hook a patient on a pharmaceutical drug. You know, everybody gets mad at pharma. I'm trying to balance the argument here. You should be mad at the supplement industry too. So now or these types of practices. So now they're hooked on the supplements, and you know, the guy's making a big profit on the supplements, and that's his practice revenue. Is it the right thing? In our opinion, no, because you have to fix the brain. If you fix the brain, the supplements, in large part, and that's the goal. The goal in large part is to get you off the supplements, because if you fix the brain, the gut can heal. If you fix the gut, you can fix these other things like the thyroid and the adrenals. That's the idea. That's the new model, or this needs to be the model for chronic pain.
Yep. So that's why there's no silver bullet.
Mm-hmm.
And there never will be.
Right.
No matter what they tell you. And if you're taking, now I'm not your doctor, but if I'm taking lots of supplements and I'm thinking, I'm not sure that these things are working, they're not working. If I'm taking lots of supplements and they're making me feel bad, and somebody's telling me I should be taking a lot more, or I should keep taking them because I'm just, you know, getting used to them, I'm not taking them. Okay. Supplements either should make you feel better or make you feel worse. If they make you feel worse, you should stop taking them and find out what's going on, you know. But I hear it every day. I hear it every day. Why did I do this diet? There is no diet. There is no diet. There's no diet for the autoimmune patient. There's no paleo diet for the autoimmune patient. No disrespect intended to the author, but this is the complexity of it, okay? We use multiple diets in addition to using an allergy elimination diet as a baseline, and then it's evaluated as to what diet would be good for that person. But here's the diet. Get your brain under control, get your stress hormones down, get your vagus nerve working so that your gut is working right. Find out what's wrong with the gut. Is there H. pylori in there? What is in there? Is there parasites in there? Do you have small intestinal bacterial overgrowth? Get all that stuff out of there. Fix your leaky gut. Find out what your food sensitivities are. And then maybe there might even still be a fine tuning to the diet after that. Mm-hmm. I give the example of patients who come in here who have blood sugar problems or who can't lose weight, and have had to put them on vegetarian diets because it's been observed that when they eat meat, it creates an insulin response. So now their diet will be tweaked that much further. Okay.
Right.
There is no diet for everybody.
Right.
It just doesn't exist. We want it to. It's easier to market. It's easier to make a lot of money off of it. I can tell you that. We don't do that. So we know. And that's it, man. There's just no friggin' silver bullet. And we're doing this because those of you who ever may become our patient, and if you ask that question, this is what you're going to see. We're going to say, look at Hangout number.
Exactly.
That's it. Go watch it. And if you don't get it, then we're probably not going to do this. This is probably not a good place for that person to be.
Exactly. So we appreciate you watching, and you can go to powerhealthtalk.com for more information. You can go to powerhealthtalk.com today for the references at the bottom of the page. And again, we'll see you next week, and have a good one.
Bye.